What's going on, everybody? My name is John Stamper from John Stamper Media, and I'm excited to be back with you. We're going to have a conversation again. When I think about Spear and I think about all the great features and all the great things that Spear is doing to help dentistry moving forward, we thought what we would do on this time is speak with Dr. David St. Ledger, who's been practicing dentistry for about 29 years in New Jersey. We were just talking, if you add on dental school, it's a little bit longer, but who's counting, right? All that good stuff. So today, everybody, what we wanted to talk about was Spear community, the value of having this community where you as a clinician can talk clinical, you can talk cases like in a safe environment. And I think what's very fascinating about this community is, as you're going to hear from Dr. St. Ledger, is the caliber of the dentist that are spending time, that are moderating this community in an effort to help you, advance your career in dentistry. So Dr. St. Ledger, it's so great to have you. And how you doing?
Well, John, thank you. Thank you for asking, and thanks for having me here. I appreciate it.
All right. So before we jump in and talk all things community and what it's about and how it's helping, dentists all over the country, love to have you share with everybody a little bit about yourself, your history, faculty member at Spear, moderator for a lot of the great work that Spear does. So yeah, I'd love to have you start there.
Well, thank you. I appreciate that. So hard to believe, but I'm essentially just about to celebrate my 30th year. Graduated out of dental school in 1994 from Columbia University. I did a residency in the town I actually practice in, which is Montclair, New Jersey. And just as luck would have it, I just never left. I fell into a practice that worked well for me. And God bless, I took it over a number of years ago. And here we are, 29, 30 years later. And I just can't believe it. And very lucky. And they say luck is a residue of design, but I had no design in this. Absolutely not. I was just very fortunate that I ran into some really good, kind people who gave me an opportunity. And I've been very, very blessed with all things. It's a great town, great community. They appreciate comprehensive care, which is the things we try to preach and teach at Spear Education. So I'm just glad to be here, and started the Pankey Institute in 2004, and went there through my curriculum till about 2008. Just finished up there, and then Gary DeWood and Leanne Brady and Steve Radcliffe, all of past and present Spear lore, brought a number of us out there from the Pankey Institute to join them and asked them to eventually contribute, give back a little bit, become a visiting faculty member, continue to learn, take the workshops once they move down to the Christensen Center down in Scottsdale. And lo and behold, that was 2009. And here we are now, it's 2024, and I'm still with Spear. I love everything, all things Spear. People like us, they call us spearheads, but we just really appreciate all that they've done for us, and we appreciated that in a way. So we've given back in terms of being a visiting faculty member. I'm also a moderator for the online content at Spear, part of which I think why I was asked to sit in tonight and contribute to Spear Talk, which is not so much a baby of mine, but I've been involved with it since probably 2012 ballpark. Where I've been a moderator and helped maintain the environment that exists at Spear. So, it's nice to be here. It's nice to have a little conversation about Spear Talk, because it is just a community in and of itself that, in my opinion, is unmatched.
Yeah, I love that. And, I think about the 20 years I've been in dentistry and a lot of the different dental meetings that I would go to. And as you know, Dave, there's the trade show floor, there's the CE courses, but what always strikes me over the years are the lunch tables where, there's doctors and their teams sitting together, and stories that I would hear of in some cases that it could be one or two of those conversations at a meeting that one clinician had with another, where they garnered a tip or they shared what was going on in their practice. And in a lot of cases, that is the most valuable thing that they would take home from their meetings. And so I think what's so exciting about Spear Talk and what you all have built in this community is that although we know a lot of things have changed in dentistry, I think a lot of things have stayed the same. You know, we hear younger dentists, we hear veteran dentists talking about how important it is to have mentors and stay connected. So I thought that'd be a good place to start, is have you share a little bit about the community, but how it's helping, dentists stay connected, stay on top of techniques and tips and all those things in a very, very, fast changing, evolving world of dentistry.
Yeah, so it's interesting, patients talk about dentistry in my community, and for whatever reason, they recognize how much dentistry's changed. And I think part of it is because I've had so many patients for so many decades, the same type of patients, and they've seen all the things that I used to do and things that we now do, technologically advanced and whatnot. But for patients, who don't notice a lot some of the times, for them to notice, it obviously has to be significant. But within the profession and in the industry, it's constantly changing. The materials change constantly. The technology changes constantly. The concepts change constantly. All the things that I learned early on at the Pankey Institute and early on at Spear Education, they've dialed back with a couple of concepts that we thought maybe were gospel and maybe now aren't so much, but they're willing to at least go in a direction based upon evidence-based research, which is basically the crux of all the things that we try to uh, give to the participants in the workshops and the seminars, as well as a Spear Talk. So Spear Talk, if I can do this real quick, it's kind of an interesting little thing. So uh, Frank essentially explained his concept of the idea of Spirit Talk, and he essentially uh, likened it back to his wonderful days he used to have at the Pankey Institute when he would come down and speak in Masters Hall, and he would spend time with some other greats like Pete Dawson, and he used to tell stories that he would sit in the evenings at the Pankey Lodges, where we would sit in the evenings a lot of times in very, very relaxed circumstances, long after a very long day of workshops. And we sit and we just talk and we throw up concepts. We have a little bit of CE, and we just kind of get vulnerable and we talk to each other about our practices. So he tells a story about Frank and Pete really enjoying their time in their company. And he said, I created Spirit Talk because I wanted this to be a virtual lodge where people can come together when they can't be together. And he understood it wasn't always easy for everyone to get out to the campus, as I call it, the campus out in Scottsdale. Um, but essentially, he was hoping to create a community, an online community, where it would be possible for anybody and everybody to ask for anything. Okay, ask for a recommendation on materials, recommendation on how to start a case, all types of philosophies, and you know, it's boundless, even to the point where people ask, where to stay and what to eat when they come out to the campus. So it could be something as basic and simple as that, or something as complex as posting a case in terms of where to start, or here's where I'm at. Tell me what I'm not thinking about. And the beauty of this is that they created a very, very safe learning environment. And quite frankly, I think that's what sets Spear Talk above and beyond all those other types of dental forums that may exist, because it's very safe. And our key word is vulnerable, where it's okay to say what you want. It's okay, all of course with respect, but be okay with not knowing and asking for help and without judgment. And it's such an important part of what we do. And as a moderator, there's about 9 or 10 of us throughout the country who kind of help maintain this safety and kind of move certain particular topics forward. And we're very, very lucky that it's been around for as long as it has. There's been some ups and downs. We just had a new remake of our platform, which is going really, really well. But it's just a community where It allows people to share information, and it allows people who are honestly in private practice to be with people. Okay, we all might go to our local meetings and whatnot, but in terms of when you get involved with something as high level as Spear, um, it's nice to be around like-minded people, even if it's virtual. So we really appreciate that concept.
And I would imagine, uh, when I think about the topics that could be discussed, right? I mean, there's a whole host of them, and like you mentioned, anything from, I'm sure, very difficult cases or challenges that a clinician is having, all the way down to the simple things of, I'm going to be in a certain city, or I'm coming out to campus, or what have you. But when you think about Spear Talk, and you think about the different posts that are done, what are some of your favorite, either that you like to post, and then from your time, as an observer, right? When you're in the community yourself and you're learning, what are some of the things and posts that you like to, see that people put up, and, certain topics?
So, I guess there isn't any one particular thing that I gravitate to when it comes to responding. I really, really enjoy trying to help people along with the idea of treatment planning, from the concepts that we teach in the workshops, facially generated treatment planning, which is the flagship workshop at Sphere Education. It's a very wonderful linear way to process information so people don't get lost when they're trying to plan a case from something that could be considered relatively straightforward to something very complex, and you just don't know where to start. So we try to teach people to, uh, you know, stay within the linear process. The interesting thing is people who post have different circumstances and why they're there. Some people are other visiting faculty. Some people could be part of the faculty club where they've spent an inordinate amount of time and energy out at Spear for seminars and workshops, their level of expertise. And then there's some with just an online um, subscription, and it's a little bit more limited, but so many people get so much out of it because they choose to use the environment the way they should, with the videos, and then of course with Spear Talk, and then reading posts from Spear Digest. So some of my favorite, I really enjoy treatment planning. I really, really enjoy occlusion. I really enjoy the mystical part of occlusion that I used to be so lost in for so many years, but I've received so much help from so many smart, brilliant people that I just kind of ride their coattails and get as much information from them, learn from them, and try to treatment plan accordingly, and put pretty good dots on teeth sometimes. Those are some of my favorite things. But it is interesting as a moderator, because you're trying to kind of coach the person along and not give them all entirely the answers, and then sometimes coach them toward some of the videos, and then maybe encourage them for the opportunity sometime to come out for a seminar and a workshop, which those are really, really game changing. I will say the most interesting thing about Spear Talk, especially in the last few years, is the involvement of the resident faculty. There are an inordinate amount of visiting faculty and moderators that help steer the ship. And these are people who just enjoy what they do, just like I do. And they go on and they do it for the love of it, because they're passionate and crazed about the concepts of what we're doing every day. So they do it, they enjoy it, they want to give back. But to have the resident faculty there on a regular basis is incredibly unique. And, it's not seen probably anywhere else, quite frankly. And they're there, and they have their hands dirty, and they're responding constantly to a bevy of things, from Frank Spear himself to Greg Kinzer, to some of our newer visiting faculty, Jason Smithson, Mike Scramscat, a bunch of them. All they do it, and they put their time in after a long, hard day. And it's pretty interesting when you think about the idea that someone of that caliber took the time and got back to your posts simply because they want you to help learn and grow and enjoy the experience.
That's a great segue. So when I think about a lot of these forums, whether it be on social media or communities or what have you, I feel like over the years, Dave, a lot of the pressure, and maybe to a point, is on the moderator, or in a lot of cases, the person that put the post out there, right? They put a topic out there, and then it's kind of wait to see what happens. I feel like there's been this evolution in forums where, especially in a safe environment as is Spear Talk, where the comments are probably just as valuable, if not more valuable, when people start to chime in. And I'm sure you've seen thousands, but is there any
Sure.
particular post or comment that you can think about when you were in Spear Talk and you learned something? In other words, like, wow, like that kind of came from left field, but never would have thought of it like that way. It was super helpful, and so therefore is just another avenue, like you mentioned, of the value of people chiming in, even just in the comments.
Yeah, so it's really interesting. Some posts just create a life of their own. I mean, they really do. They're their own entity, and it's fascinating how this happens sometimes. Um, the idea that someone can post something with the hope of getting some answers, and all of a sudden they have 5, 10, 15, 20 posts, and it's people coming to the rescue and people enjoying what they are looking at and reading, and people, interestingly, I think it's the visceral thing where people say, I know who that is. I used to think like this. I used to post questions like this. Now let me help someone who's now in my shoes, and I've been able to grow and learn, and let me share what I did and share my failures and share what worked well. So, because I've been involved with Spirit Talk for so long, it would be impossible just to single out one particular or even a handful of posts. But it's essentially like what you said. It's John Q. Public dentist who has either an online uh, opportunity, or they're visiting faculty, or they are in the faculty club, and they just enjoy what they're reading, and they're more than willing and happy to help along. Um, yeah, it's endless. I mean, it really really is. It's part of the niche that we've created in the community. As far as the idea of helping people, when we have our meetings sometimes as moderators, we try to say, okay, let's get the bagels off the board. So the post it used to be listed different in terms of how it's structured and how we used to see, and it would be X people are fishing, and there's like 6 looks, 10 looks, 20 looks, but there's no replies. So those are the type of things where we want to get the zeros off the board, so someone at least knows that it's worth their time putting this out, and that's really when it gets sometimes like, oh, let's really make sure we get this taken care of, or we'll privately email somebody who will probably have a little bit more to share about this, and which is the amazing part of the community, right? Like I've met so many people so many years at the campus, through all of this, and I know what they do and I know what they're good at, and I'll send them a message to see if they can respond to this in a way that probably any of us can't, and it's sometimes a swift response, so it's nice.
The 2024 version of the Lifeline in Spear Talk. I love it. Calling for the Lifeline.
Indeed, absolutely.
uh, how about any of your own cases? So can you talk about when you shared a case of your own in the community, and what that experience was like?
Yeah, so and it's funny you ask this, because this is not a setup, but it's uh, two things I really wanted to talk about was what Frank had envisioned. But the other thing I really want to talk about when I was asked to consider doing this was particular cases. And one case in particular I posted uh, is the essence of the community of Spear Talk, resident faculty, visiting faculty, just anybody with some kind of an online subscription contributing, um, and then a local person helping me out. So this is, I think it's 2012. Okay, so uh, years before that, we used to call this a microsite, and it just behaved different. So the Spear Education, Spear Online wasn't even what it was, and it's constantly evolving and growing, and it's massive now. But in 2011, not so much. It was burgeoning, and we had a microsite. It was still Spear Talk, and we would post things, but it was nothing as sophisticated as it is today. So this is about 2012, 2013, give or take. And I was doing what we would call transitional bonding. And I was doing a full mount transitional bonding. And essentially, it's a circumstance where you are going to use composite resin material throughout the whole mouth to mock up what you'd like things to potentially look like in a final outcome years down the road as you transition this person away from this material to something more definitive like porcelain. And generally, this sort of thing happens with wear cases where people have such wear that they can't necessarily afford to appreciate full mouth dentistry. So what we get taught to do, and I never learned how to do this at all until I went to Spear Education, was to phase treatment in great workshops like the Warren Dentition, okay, for example, or anterior restorative dentistry or restorative design from Bob Winter. And these skills allow people to be phased so you can treat them in a certain way in the way you want, not compromise your work because people are so overclosed in how they're built because of all the wear. And then you have the opportunity as the years go by to rebuild the person based upon how they have the opportunity socially and financially. So this was a daunting case, and I only did it because of all the things I had learned. Uh, and forgive me if I'm going over at all, but I can tell you that it started with the wax up, and Bob Winters spent 20, 25 minutes with me on the phone when he was more heavily involved in his original lab, talking to me about the case. And now fast forward, I post all this information that I'm looking to do, and I'm looking for help and insight for this case. I told him I'm going to start it in a couple of weeks. I'd love to hear what people had to say, and I got a number of responses. But the most interesting response was the night before I was about to start. It was a gentleman who actually is probably no more than 40 miles from me, 35 miles. His name is Alex Greenwald, and he's a dentist through Spear for a while. He's already a visiting faculty member at the time. And he sends me a private message, and lo and behold, a few hours later on a Sunday afternoon, he's talking to me on his own time about something extra that he thinks would be helpful to make this case move nicer when I'm doing it tooth by tooth the next couple of days. So he told me what to do. I went into my office. I made what he asked me to make, and lo and behold, it was a palatal jig, but it was used in a way that I had not been able to use before, and it made the world a difference. And so think about that. I mean, so many people came together for me, and that's my driving force as to why wouldn't I do this as much as I can for anybody else. And here we are in 2024, and I still love doing it. And that's why. I mean, why wouldn't I? Right?
Yeah. And I think that story, I mean, I can imagine, Dave, like that's just one story. So when I think about all
Yeah.
the posts, all the sharing, all the comments, like who knows, right? The power of bringing all this together and what, you maybe don't always see or don't always hear. And somebody takes one or two comments, from somebody in the community and then applies that in their practice and just continues to build on that. The other thing I wanted to ask you is when I think about everybody's time now, I mean, time's always been valuable. It just seems now lately like it's even more so valuable. Like it's so much more precious.
Yeah.
And we have these mobile devices. And let's call it like it is. When there is time, one of the nice things I'm sure is to be able to get into the community on the mobile device, even if it's
Mhm.
just respond or post a comment. Can you talk about what that's been like and how that's changed the dynamic of making sure that people can stay connected even in their busy life?
Yeah. So for me, it's as valuable for me as it probably is for anybody, largely because I am a moderator, and I have the responsibility of kind of trolling the site on a pretty much a daily basis, and then moving, try to move things along a little bit, even whether it's publicly with a post or privately with an email to someone about getting someone some help. So the app has been fantastic because wherever I am, I'm not always going to open up my laptop, and I don't have that opportunity. So the app has been huge to at least allow me quick ways to troll and take a look as to what's transpiring since the last time I was on. Um, that to me has been the most important part. Previous apps were beneficial and they were helpful, but the way it's structured now is way more easier to manage and deal with. I even take it when I'm over teaching my residents at my local hospital where I teach at. I often show them just quick little posts, because when you're at the hospital, the way HIPAA is nowadays, there's no way I can get access with my laptop. So I just pop up my phone and show them some posts. And essentially, I do that to them because they're just coming out of dental school and they just have this, oh my God, I don't know anything.
Yeah.
And although that may be not necessarily 100% true, I say, well, look at what some very veteran people are putting out asking for help. It's never going to end. You're going to be asking for help. You're going to be learning until you retire. And it's been a really, really helpful tool for me to get them to understand that it's okay not to know. As long as you don't, as long as you know what you don't know, um, everything will take care of itself. So it's been really, really helpful in that respect.
So as we wrap, I know the community is a part of Spear membership, right? And only one valuable aspect. There's so many valuable aspects to become a member of Spear. So I want to touch on that as we wrap. But I did want to ask you, hearing you talk about this and that quick access that a newer dentist would have, do you ever think to yourself, Dave, wow, what would this have been like when you first started out? Like you mentioned, to have access to these clinicians, and like you said, Frank jumping in every once in a while, Dr. Winter. I mean, it's like, I've been in dentistry for 20 years, and those names were so influential back when I started. And so I can only imagine what it's like for some of these newer dentists. But like, do you ever think about that? Like, and I ask that because I think it really stresses the value of not only this community, but obviously being a member of Spear. Of course, tonight we're talking about the community, but yeah, just love to you share your thoughts on that.
Yeah, it's. I think about it all the time, and the reason I think about it all the time is because I have an associate now, and she's just out of residency, and she's a wonderful, wonderful dentist. And she has an incredible thirst for learning, and we do cases all the time. We're talking about things all the time, all the things that you would see on Spear Talk, from cases to materials to philosophy to behavior, managing patients' expectations, all types of things. Okay. So I say to her, we're doing all these things, and I do it because when I was out 2 years, 3 years, 4 years, 5 years, I didn't have this. I had some really great colleagues in the area who I still work with and spend time with, refer to. But it's just a different level of idea when you're spending time, with like-minded people who have such advanced desires to push dentistry as far as they possibly can. So when I'm sitting with her, it's essentially, my enjoyment of that is because I didn't have anybody early on, and I am understandably not at all an extension of any of these people, any of these venerable resident faculty who are so incredibly helpful. But with all the things I've learned from them, through them, and all my amazing colleagues that I've met all over the country, that I've taken all these workshops with and spent time with, and then personal time with, I'm just trying to be an extension of all the things that I've learned, because those first handful of years, they certainly weren't wasteful, but if only I had the opportunity to get to that right away. And now it exists. I mean, going back to my residents, year after year after year, when I see them and I show them things about spear education, and I will tell you that my resident program has a subscription to Spear Online. That's not some nice little thing that you all should know. And they do a lot of work through Spear Online. And I just try to get them to use it in a way that might be most beneficial for them. But it really, really makes an enormous difference. So by the end of the year, I said, please at least allow yourself that 7-day access where it's not going to cost you anything. But this is your security blanket, and you'll never get lost, and you'll never be alone. You'll always have someone to help, and it's just full of knowledge with all the videos and things in Spear Talk, Spear Digest, and you'll always have someone who's going to be there to help you, and that's really a nice thing to have when you're just coming out of school, residency, going into private practice. And especially even little things in terms of connecting with people. You know, as I said, with Spear Talk, you can see the place will be riddled with, I'm looking for a dentist in ... what town, city, or state. Or some people will post, I'm looking for a like-minded Spear dentist to come join my practice. And one thing I've noticed is with young students and residents, as they, more than any time that I've ever noticed in the last 5-10 years, and I've been an attending at the hospital for 26, they're willing to travel. So you never know what's going to happen on Spear Talk where the opportunity can present itself. So that's why it's a great opportunity to at least get online and join.
It's awesome. And I was also thinking, I think about all of the individuals that go to campus out in Scottsdale, and, you know, another great way, which I'm sure it's talked about when you go to campus, but like, you know, you meet a new class of, you know, clinicians, and many of which I'm sure in your case become lifelong friends and colleagues. And it's just another way, you know, to stay connected with them once you leave campus and are excited and learn all these new things. So, listen, Dave, this has been awesome. I know the Spear team was really excited to have you share. No secret why you're the moderator. You've done an awesome job of kind of giving a great overview of what Spear Talk is. And I really do hope that everybody that's watching this, you know, if you're not a member of Spear, you know, please, you know, learn more. There's just so many great resources I think that you'll find. And of course, Spear Talk is definitely one of them. So before we wrap, Dave, any final thoughts?
Oh, no, just I'm just grateful for the opportunity that was presented to me a number of years ago. I'm thrilled I leaned into the uncomfortable part of learning, because once you get through the portion where it's uncomfortable, the growth is exponential. And, you know, I tell my staff all the time, you're not growing if you're not uncomfortable, and there's nothing like being uncomfortable. So try to do it as much as possible. And then it just becomes a habit, and then you just can't get enough. And here I am, and I'm grateful for all the people who I have ridden their coattails. I always tell all my staff that all I do is hang out with people way smarter than me, and it's been a great ride. So I appreciate your time tonight, and thank you for letting me speak with you.
Awesome. Uncomfortable and a safe environment. It's Spear Talk, everybody. Learn more about it. Yeah. And hope to see you at an event and or on the forums. Thanks so much. Appreciate it.
Thanks so much, John.